Hi there, and welcome to the award-winning Ed Brown Show. I'm your host, Kamaria Richmond, and we are continuing our interview with Dr. Jasmine Bradley. And thank you for hanging in there with us. And I wanted to start with, why did you want to become a chiropractor?
Again, thank you so much for having me. I really
Our pleasure.
it. Oh, this is awesome. But yeah, I started out as a small child, wanted to be a star. Mm-hmm. And then I wanted to be a cook or a chef, and then a justice, and then a doctor. And so as a kid, maybe about 5 years old, I'm doing exams on everybody. Everyone's walking around getting a Band-Aid and a clipboard. I wanted to be a surgeon because I wanted to repair the cleft lips and palates. My dentist had a lot to do with that, but he passed. And I think I was about 15 years old, and I was in my second car accident with my mom. She had just left getting her vehicle serviced, and this car had hit us. We were on 495. It was a young man in a green car, and he was dancing. He did not see the debris falling from this metal truck. And his dreads were just flying everywhere. Like, this man was having a full-on concert. And as a result, his tire lost control, hit the debris. He bounced across all the lanes, hit us, and bounced back. And after that, I did have some pain in my neck. Also, I was a volleyball player, and I'm like, oh God, I'm out of my sports for a minute. I can't do anything. So I was upset with that. And then going to the chiropractor, I said, wow, this is awesome. I'm feeling pretty good. This is helping. I was like, I need to look more into this. So that car accident was the thing that had me to really look into chiropractic, and I did my high school vocational paper on it, and thank God I'm here today.
That is amazing.
I know, right?
That is amazing. It's chance. And we were going to talk about the therapeutic modalities.
Yes.
And you gave me a list of quite a few.
Yes.
So let's start out with the therapeutic ultrasound.
Absolutely. So therapeutic ultrasound, you can use this one for like bursitis. You can use it for sprain strain, soft tissue type things. You can even use it for patients with plantar fasciitis, so flat feet. You can do different things with that. You would not use it for children, so patients that have growth plates that are open, or also if the region is fractured. It's a great modality. I used it for, the other day, a patient, she had really bad pain along her IT band. She's a runner, she's an athlete. Okay. And so the soft tissue, she noticed a big difference. So pairing that with the chiropractic adjustment, you can do the therapeutic modality before or after. So it depends. But that one is a really good one. Another one that you might see, and also insurance, most insurances does cover the therapeutic ultrasound. They will not cover cold laser, low-level cold laser therapy. They're saying because it's still pretty new and they want to have more research. But that one also has really good results. That one you can use on fractures. You can use because it will promote more healing as well. They both penetrate through the tissues, working on relaxing the muscle, the spasm, the sprain strain, also promoting better blood flow and circulation. Laser penetrates through the tissues and the red blood cells and promotes regeneration. You can use it on bruises. I use it on my car accident patients a lot, especially ones that have those airbags that deploy. You know, you see them with a black eye or ribs. You can use it for many different things. Laser's a really good one to use. Another therapeutic modality that you might see more frequently used in chiropractic offices, ones that the doctor or the chiropractic assistant doesn't have to attend to, because with ultrasound you have to continue to move the sound head. You can't just let it sit there. Laser, you can just hover it over, you know, that's fine. But stem heat, so it's electrical stimulation, and that's where you put the little leads on. You'll feel like the little sticky pads go on. And that one, I tell my patients, the best way that I can describe it is when we turn it on, you're gonna feel little creepy crawlies. That's the best way I can describe it, because like if you haven't had stem before, you're like, I don't know. So you're gonna feel like a creepy, curly sensation, but what I want them to feel is a kneading of the muscle. So that's gonna help to relax the tight spasm. So it's gonna help to loosen the segment. Usually I might do the stem and heat prior to the adjustment, depending on if the patient has a really tight neck or back or the knee or whatever the segment is, just to loosen it up prior to doing your manipulation. That's going to penetrate through. You can also pair it with heat, so it could be moist heat or a heating pad, or if it's a recent sprain strain, you can put an ice pack. So to bring down inflammation or promote loosening of the segments. So that's what you can pair stem and heat with. Yes.
Interesting. And then you had some soft modalities.
Yes, the soft tissues. So that one, you can use like a hands-on technique. So ART, active release technique. That means the doctor is going to contact, and then the patient's going to do the exercise or the stretch that they tell them to work on releasing the spasm to loosen it up.
Okay.
Or you can do myofascial work. So myo is muscle, so fascial, so you're releasing that. The doctor's going to do it all. The patient's just going to rest there.
Okay.
You can also do Graston technique. That's a soft tissue modality where you can use either bone. It's a tool made of bone, or it could be jade or plastic or metal, various things, and you're going to use that with some kind of a cream to go along the muscle to relax it. But you're going to warm the tissue first, then you're going to go in, and don't be alarmed, patients, but if the area is red, that's expected. So we're trying to promote the inflammatory process. So that way the segment loosens, and then you're going to do that till it's red, and then you ice it for 3 minutes, and you can do an exercise after to rehab it. That's a really good one. The other one is gua sha, which I do not do. It looks very similar to Graston, but that one, the angle is different.
Okay.
There's so many different modalities. You can also do rehabs or exercise. Of course, you want to do that. Things are going to strengthen those segments around. So after you've done your adjustment, you do want to learn some exercises, maybe a couple visits after, to work on strengthening, maintaining, and preserving your adjustment.
And I wanted to ask you, so I say, you know, Dr. B, I just have some pain in my shoulder. Can I just use an ice pack?
It depends. It's like, what happened? You know? So I want to know what happened, because, like, is it a dislocation? Did we fall on it? Did someone knock it out?
Right.
Did you bump it against the wall? Were you lifting something? Did you feel or hear a pop? So that way I need to know what's going on. Usually within the first 24 to 48 hours, we recommend, if it's an injury, ice. And then day 3 and after, well, day 3, you want to alternate between ice and heat. And then following, you can do heat to loosen it up. But if it's swollen and injured, I want to make sure it's not fractured before we go doing something with that.
So if I do have, let's say it's an excruciating pain, do I call you, go to the ER, or go to my primary care? What's my first step?
So the thing, if it's excruciating pain, so I'm going to say if there was a trauma and it's excruciating, I'm going to tell you to just go to the ER.
Okay.
You know, because we want to make sure it's not fractured or dislocated. If it's a dislocation, you got to get that shoulder back in, you know, prior to the longest out. The more painful it is, you want to make sure there's no impingement, because you do have these different nerves that come out from the neck and supply these regions. So you want to be careful not to pop your own shoulder back in. I've seen that. Patients have done that. Yes. So that's how you get impingement. They're like, oh, my hand is numb. I can't move it. I can't lift it. You know, you want to make sure that you're in the right place. But if this was something where it wasn't as serious, it's like, yeah, come on in. We'll check out your shoulder. We're going to do the exam. We'll take you through ranges of motion, see which muscles are involved, what actions you can do and which ones you can't do. We'll do a few orthopedic tests, like you can do Dugas or Yergesons, like checking it out, biceps tendon. And then you can go in and do the shoulder adjustment, depending. And then after that, we might tape it. So you could do kinesio tape. So that's like the tape you see With the Olympians, the athletes, they have the different color tape.
Yeah. What is that?
It's awesome. So the thing is,
I always wondered, like, what is that tape? What are they using?
It's pretty cool. So the thing is, you have to let your patient know, like, look, now that you have this tape on, please do not think that you could just go back to your regular activity, because that's like, oh yes, I'm back, I'm 100%, I can move my arms, I can do stuff. So no, the tape is actually working with the muscle to allow them to do that movement. But when they take the tape off, because they just had this happen to them, they're gonna feel like, oh my God, it feels terrible again. You can keep the tape on, depending on how it's worn. So maybe 3 days, sometimes 5. You can shower with it. You can pat it dry when you get out the shower. If it's starting to peel, remove it. But we can always retape it again. But it's just a way that the patient can get through their day. You can tape sprained strains, so that way they can kind of move. So that's why they were saying, oh, these athletes, they're cheating. But no, they weren't cheating. They were saying it was an enhancement type thing. Or anything. No, it wasn't. It's just allowing them to still be able to get through the movement.
That's interesting.
Yeah, just like you saw the cupping, you know, the circles, it looked like the octopus, like latched on
So tell me, so what is that?
Cupping is another great technique for soft tissues as well. So with that one, they're going to use those glass jars, and you'll have a heat source, and you're going to go over the region, and it will suction it. So it will bring the impurities and the toxins to the surface of the muscle to help to relax it. And when they take it off, this is where you see those ringlets.
Do those ringlets go away? Or
yes, they do. Yes, they do. It's not permanent.
I'm like, you see them and everybody has those. I'm like, do those come off?
Yes.
But does that give you like instant relief, especially for the athletes?
A lot of people do, yes. Same thing with like soft tissue, other soft tissue techniques, Graston, like maybe when you're going through the Graston, some people have more discomfort than others, and some, they say, this really hurts. And some say, this doesn't bother me at all, you know? So they said, well, I noticed afterwards, I can move my shoulder further, I can turn my neck a bit further, I can bend down further, like depending on the region, or I can extend my leg with less pain. So these different soft tissue modalities are great, and I believe you should pair them with the chiropractic adjustment, because it all benefits. It's all, you know, related. You don't want to just adjust the spine and not do anything else, because, for example, your patient might come in with like tension in the back. You hear that, like, I have tension in my back, or it feels tight.
Right.
So if you go and assess and do your range of motion, you feel and you watch like how the muscles are moving, you'll see that, right here, this person has a trigger point, or muscle spasm, or a tension knot. It's all the same. It's a buildup of lactic acid. So the thing is, you can go thrusting or side posturing or dropping or activating all day, but if you don't do something that's going to loosen up this soft tissue, the patient's still going to have that complaint. So you have to do something to loosen the tissues first. And then you want to do that. Plus, it's just a nice thing to do for your patient. You don't want to give them a rough adjustment. You know, things are tight, and you're like, oh, let's go do the adjustment. And they're like, oh my God, that was kind of rough.
Hurts.
Yeah, so you just want to do something that's going to help your patient to get better, and also they'll notice that those knots are starting to decrease and get smaller, and they'll have less pain, less discomfort, more range of motion. They can move better, they're happy, and they're going on with their life. That's what we want to do.
Right.
Yeah.
And what about, so are there some adjustments where, you know, some things just cannot be fixed, like you just have to just live with whatever damage has been done?
It depends. It depends. So that's a really good point. That's called MMI, maximum medical improvement.
Okay.
So sometimes you have to know like when your patient has reached that point, because it's like at this point you've done everything, you've exhausted all the training and the tools you had, and you know, it's just kind of pacifying them. So it's like they're doing pretty good, but then, oh, the pain is back, it's I feel good for 2 days and the pain is
And then
back.
it's back, right?
Yeah, and so it's like, are you still doing the exercise? Are we doing this? Yeah, I'm doing it, but it feels better when I'm here and then it's back in 2 days. So it's like
Right.
knowing what's going on. Maybe you could be not the proper doctor for them. Maybe they might need something else. Like, have you offered all your modalities? Have you exhausted everything that you've done, your training?
Okay.
So maybe they could benefit from another type doctor. Maybe somebody that does Pedibond, like a more aggressive type thing. Pedibond, that's another chiropractic technique. That one they will use like a lot of people are seeing this now with the chin strap. So that's when the patient is resting on their back, and then they're going to use the strap, put it under, and the doctor kind of does a tug and like a deep step and a pull. And that one you can just feel like all the segments in the spine are adjusted. Some people really like that. So like, and some people may want something more gentle. Like they said, I just want you to do the activator. But the activator has a little kick too. So it just depends.
Okay.
So you might need to refer them elsewhere too. So that's no big deal either. I mean, you can still like co-manage with them here and there. They might have another issue or something else. But yeah, that's that. Some patients that you would not adjust, like I said, if they're fractured, you don't do that. If they're a patient with ligament damage, like hypermobile, you do not want to go adjusting into a segment that is already unstable.
Okay.
So that's somebody you do not want to touch chiropractically. You can do physical therapy with them, work on training those muscles around the segment, and work on strengthening those, but do not adjust a hypermobile segment or a fractured segment. Yeah, you can adjust pregnant moms, but with them, you don't want to do therapeutic modalities. You want to be careful with that. And pregnant moms love chiropractors.
Really?
They love chiropractors, because they can't take pain medication.
Yeah, right, in the back and
yes, their ribs, the whole thing. They're like, my ankles are swollen.
Right.
And you said, okay, let's check you out. Let's get you on the table. We do your ankle. We can adjust them. You can adjust the rib. They're missing, like, you can adjust their pelvis. Because, the baby is moving. I'm like, yeah, the foot is here. I can't breathe. They're talking about different things, like my back. And depending on how big the abdomen is, you might still be able to side posture the mom too. So that's when she's laying on the side, you can do her lower back. And then depending, if you have a high-low table, like myself, you can actually bring the pelvis up so that way her abdomen can drop down. Because a lot of times the pregnant mom wants to lay on the stomach, but they can't. Right. So you can actually crank the pelvis up and do the drop that way. So you can do that, like if you can't get on her side. Some doctors' offices, they may have like a pregnancy type foam type thing. So there's an area for the abdomen to lay as cushion. So that way she's on the table, and it's also a place for the breast. That way you can put them on the stomach, it's cushion. You can do your adjustments that way.
Interesting.
And you can stretch them, exercises. They love those. But plus, their ligaments are becoming more lax, preparing for the baby to come. So you can still be careful with that. And also chiropractors, some of them are trained to do Webster's technique. So that's for like the breached babies.
Okay.
Yeah, so you can help to work on turning the baby to prepare to come out. So you can do that too.
Now you can do that in the old days, but now you can actually turn the baby?
You can, so you can try. So depending on how far the mom is and knowing before she's going in to give birth, you can absolutely try Webster's technique. You can try it a couple times. Because like if the baby's breached, she's like, I really want to do this, but my baby's breached and I'm trying. You can do that.
Okay, and I want to just ask you quickly about children or infants. Do they need like special, I guess they have special needs?
In chiropractic school, at least at mine, Palmer in Florida, we learned that the first trauma is actually the birthing experience. So like if your mom had the baby vaginally, or even if they did the C-section, because what's happening, the baby's coming through this canal vaginally, and then you have somebody on the other end with their hands around the baby's head,
Right.
pulling, yanking the baby out. And then you notice some of these babies, when they come out, their head is like this.
Mm-hmm.
It's like, and they don't want to turn. I'm crying. I don't want to turn my head away. Or the mom may notice, yeah, I'm trying to feed my baby, but she doesn't want to latch onto this breast, but she'll do this when they don't want to turn their head a certain way. So we know there's a little interference there in the neck.
Okay.
We got to adjust the neck. Or also, you can adjust the child. Some people have a chiropractor on hand, like right after the birthing process too. You can also adjust mom too, if you want to go in with her.
Oh, that's great. Like
Yes.
right after?
You can do it right after. Babies
Wow.
is totally different because their little bones are still like forming and developing, very soft. You're just going to use the very tip of your finger to do the adjustment. You can hold on to the baby and do the adjustment, or you can let mom hold baby, or dad can hold the baby and do that. And their exam is totally different than, like an exam you do for a 3-year-old or a bigger person, someone that can answer questions and follow along.
Okay, and you also want to talk about, so you have the diversified, the Thompson drop,
Yes.
and the activator.
Yes, those are just a few of the various types of chiropractic adjustments.
Okay.
So like we spoke about before, you're not a fan of the diversified adjustment. So diversified means like hands-on.
Okay.
And chiropractic, that's actually what it means, done by hand. Chiro means hand. And so that's the one where you're going to be in a side posture for the lower back. So they might say lay on your side and the doctor kind of thrusts through the joint.
Okay.
Or they're going to do your mid back. They might give you something. You see people doing a bear hug and you hear, that's that.
Right.
That's not what you're looking for, but you have some people that's like, yeah, do it. And then you have the ones for the neck. So you're going to like kind of lift and turn, or either way, if you don't lift it, you're going to do it by hand manually. That's
Okay.
when you hear the cavitation. You can do it for elbow, wrist, hands, knees, ankles, feet. We do the full spine.
Okay.
Yeah.
Okay. And what's the most popular out of all of those? If I say, you know what, I want diversified, I want the Thompsons, or I want the activator.
I mix them all up. I do them
Okay.
all. So like it depends on what the patient needs. So it's like I'm able to assess the patient. I'm like, yeah, this is gonna, like, I didn't even know that was there until you started like poking that, like, ow, Dr. B. I said, don't worry, we're gonna get this right. We're gonna work on it. You're gonna be happy. You're gonna be better. So just like assessing your patient, seeing what's going on, what do they need. You can mix them up. Like you said, some people do not like the hands-on approach. So you said, well, let's do drop and some activator. Let's do some soft tissue and stretch it. Let's do that. Then you have some people, I don't like the activator. I just want hands. Okay, cool.
Okay.
Let's do it. It said maybe a person's coming in with sciatica. So true sciatica is when the lower back pain travels down to the foot or just above the ankle. But if it stops at the knee, that's not true sciatica. So a lot of people think, yeah, it's going down my leg, I have sciatica. So I have sciatic type pain. But you can do decompression. So decompression table is pretty good because that one, you're gonna strap the patient in with a belting system, and then you're going to put the bolsters under their knee. And then depending on the table, you will find out, you ask them what's their weight, and you're gonna set it according to that. And then you can do a maximum amount of pull for pressure, of poundage, of how much it's going to distract. If max is 50%, and then you can set that. But usually I don't start out at the full max
Okay.
because that might be too much for the patients. I want to see how they're doing. And then it's going to do like a gentle pulling and then go back. So it's going to allow for the material to go back toward the disc, rehydrate. It's a very gentle technique. It should not be painful.
Okay.
You can also do this for the neck as well, like if they have radiating pain down to the hand, because you can also herniate or have a disc bulge or rupture in the neck, the back, the mid-back, whatever. So those are two other options. As well, you can do flexion distraction. So that's like the doctor's going to traction the back, there's a handle, move it around different directions, or they might even have one that does it automatic. So they can just set them and kind of like set and forget. but don't forget your patient's on the table. But it will do that too. So it will allow for the movement, for the materials to go back toward the spine. But it should never travel down the leg. So if you're doing one of those techniques, make sure you speak up and tell your doctor. If it's going down, that should not happen.
Okay.
It should be local.
And should we ever, we have a couple more minutes, should we ever have any deep physical pain?
No.
Okay.
So if you're feeling like a deep physical pain, go get it checked out. Seriously, because that could be anything. The good thing with pain is it's letting you know that something's going on with your body.
Right.
You know, because it could be bone, you know, that's usually like deep, gnawing pain, and nothing makes it better or worse, and that's really scary because you want to rule out cancers and things of that sort.
Right, right.
If it's like a throbby type pain, you know, it's muscle. If it's like stabbing or burning, we're thinking nerve. So we're like, what's going on? How do you describe it? So that's why you want to let your patients talk to you. Listen to them. Don't just come in the room. I know what's going on. I got it. I'm the doctor.
Right.
You know? Like,
that's the thing. Yeah.
Can I tell you what's happening to me, please? You know?
Exactly.
So you have to listen to the patient.
Right.
And then you go from there. Listen to them describe it. Let them point to you to show you what's going on. Chiropractors, we're in school for a long time. Just learning the muscles, the bones, the joints, and how they work and function. We're in the lab more than the medical doctors, the orthopedists, and the physical therapists. So we have more clinical experience with that.
Interesting.
Yes, so you have to
very
know
interesting.
this top to bottom.
Well, that is very interesting.
Yes.
I never would have thought about that, but I mean, you are working with, you know,
the full spine.
The full spine.
You need to know this. How does the muscle,
right.
what action does it do? What makes it better? What makes it worse? Should it go that way? Should it not? You know, you need to know this.
That is interesting.
Yes.
And tell us, Dr. B, I'm going to call you Dr. B because you're just Dr. B.
That's cool.
How can people reach you?
So you can reach me AlignChiropracticDC.com. Also, you can find me on ZocDoc. You can put in Dr. Jasmine Bradley. We're located in Glendale, Maryland. So the name of the office is Align Chiropractic. We're in Glendale, Maryland. And you can also find us on Instagram.
Yay! So we know people love Instagram.
I know. You tell me about it too. So yes, I'm learning. People love Instagram.
And she's going to show you. She's going to actually give you videos on how to do this. So thank you, Dr. Jasmine, Dr. B, for being on the award-winning Ed Brown television show. And we'll see you next time. Thanks for tuning in.